Hello students, how are you all? Welcome to today's class. Today we will be discussing on Kramer's modified Kramer scale and how to use it. So before proceeding to today's class, can you make an interpretation from this image? Yes, it's a progression of neonatal jaundice. You can see the skin color, it is changing gradually from normal tone to yellowish discoloration and then progressing to the dark brown color. In previous class, we discussed on neonatal jaundice. It is one of the most common condition in newborn and due to various factors like condition leading to increased bilirubin production, immature liver, poor feeding, infections and metabolic disorders which can affect the bilirubin metabolism and result in neonatal jaundice, that is yellowish discoloration of skin, mucous membrane and sclera because of accumulation of excessive unconjugated bilirubin in the tissue. So assessing its severity is very important for timely intervention and preventing its complication. So today we'll be learning on how to use this modified Kramer scale, which is a very simple yet very effective tool for assessing the severity of jaundice in newborn. Now, what is Kramer scale? Okay, it is a visual assessment method used to evaluate the jaundice intensity in the newborn. It estimates the severity of jaundice based on how far the yellow discoloration has extended across the body. Okay, it follows the cephalocaudal progression, which means the yellow discoloration it is spread from the head downward through the 5 distinct zones. You can see in this image the body has been divided into 5 different zones correlating with the rising of bilirubin level. It is a very quick and non-invasive tool which is very ideal for bedside evaluation, especially in the setting where laboratory testing isn't available immediately. So now we will understand each zone one by one. Zone number 1, which says jaundice is limited to face and neck, and this indicates a very mild type of jaundice where bilirubin level it typically ranges from 4 to 6 mg per day. Now zone number 2, the jaundice it extends to the chest and upper abdomen, suggesting bilirubin level between 8 to 10 mg per day. Now third zone, where yellow discoloration is spread to the lower abdomen and thigh with bilirubin level around 12 to 14 mg per day. And zone number 4, the jaundice reaches lower limbs and arms, limiting bilirubin level from indicating bilirubin level from 15 to 18 mg per day. And last one, fifth zone, which involves the palm, soles and entire body, and the yellow discoloration it covers hands and feet and suggesting that the bilirubin level has extended from 15 to 20 mg per day and which require very urgent medical intervention. Now how to perform this assessment? We have to ensure that the baby should be examined in the very good light, okay, the natural light or the bright fluorescent light for accurate observation. The dim light or shadow it should be avoided. Now second one is gently pressing the skin on each zone to observe the yellow discoloration, that is clenching the skin. And third one is assessing each zone subsequently, means by starting from the face, that is zone number 1, and working way down to the feet, that is zone number 5, and observe how far the discoloration has extended. And we always need to remember the presence of jaundice in higher zone it correlates with the increased bilirubin level. Now what is its clinical significance? We all know that the modified Kramer scale it is very quick and non-invasive tool. It provides an estimate but not an exact bilirubin level. So if the jaundice it extends to zone 3 or beyond, it's essential to confirm bilirubin level with the blood test or bilirubinometry, okay, to consider to identify the exact bilirubin level and consider the treatment option like phototherapy or exchange transfusion depending upon the bilirubin level and clinical presentation. So now what we should we should remember what are the key considerations. We always have to keep in mind these 3 points while doing the newborn assessment. We always have to be very gentle. We avoid unnecessary stress to the baby and monitor the feeding and hydration, because we all know that the poor feeding, it can worsen the jaundice. And last one is monitor the jaundice. Like, so if jaundice is appearing in the first 24 hours or spreading so rapidly, then this require intense medical attention. Now, coming to conclusion, early assessment saves life. The modified Kramer's scale is a simple yet powerful tool for assessing jaundice in the newborn. So with practice and vigilance, it can help ensure early detection and prompt treatment, and paving the way for the healthy start in the life. Thank you for your attention.